Hi, I'm Dr. Laura Neustater. I'm a pediatrician with Holy Cross Health. I've been in practice here for 25 years. I'd like to talk to you today about the importance of vaccination, specifically for children. The most important vaccine right now, in my opinion, would be to get your flu vaccine. They're out, they're available. Children from ages 6 months up should get the vaccine now. I know the CDC is recommending adults get their vaccines in September or October. Children, the first time they receive their vaccine, if they're under the age of 8, they're supposed to get 2 vaccines to boost their immune system. One initially, and then following 1 month later. The really nice thing about the flu vaccine right now is not only are you preventing the flu, there's some anecdotal stories, and as well as there are some studies showing that once you do get the flu vaccine, your body's immune system gets kind of revved up and you're probably less likely to experience bad symptoms from COVID, which we're experiencing now. So that's a nice thing about the flu vaccine. Okay, those children under 6 months, of course, cannot get it, and they're the ones most at risk of getting very sick if they catch the flu. So it's very important for the parents and any siblings to get the vaccine so that you can prevent the babies from getting it. And that brings me into childhood vaccines. Why do we give the vaccines to children that are so young and everybody feels like their immune system's not great? Well, that's the reason we do it. They're the ones who are at risk of getting very ill from any of these vaccine-preventable diseases. The first vaccine that children are exposed to is the Hepatitis B vaccine. All babies are offered the Hepatitis B vaccine in the hospital. If the mother has Hepatitis B, most definitely give your child this vaccine. It helps to prevent the baby from contracting the vaccine if given within the first 12 hours of life. The way you get Hepatitis B is mainly through sexual contact or through blood contact. However, if say an aunt comes to the house who does have hepatitis B and kisses your baby and they have an open sore on their lips and maybe some blood gets in contact with your baby has a chance of getting hepatitis B. So this is something preventable. Is your child young having sexual contact? No, but they might be exposed to blood products. There was a recent story in the news where a local dental clinic did not properly autoclave all their instruments. So there was blood on the instruments, and then every child who was exposed to these instruments needed to get tested for hepatitis B. So again, vaccine preventable disease, very safe, very important to give to your children. The next set of vaccines that your child will be offered is at the 2-month visit. The nice easy one is the rotavirus vaccine. That's an oral vaccination. They drink it. They take that at 2 months of age, 4 months of age, and 6 months of age. It needs to be given prior to them turning 8 months of age to get all 3 vaccines in for it to be effective. Rotavirus is a gastrointestinal disease where children have lots of diarrhea, lots of vomiting, and can't keep themselves hydrated. They often end up in the hospital to get IV hydration if they get this illness. It can be deadly, especially in developing worlds. People do die of rotavirus. And very safe vaccine to give. The next vaccine you'll be offered is often in a combination, but the first one, there's the diphtheria, tetanus, pertussis. Diphtheria is a illness that causes something called a pseudomembrane. It kind of blocks off the nasal passages and the throat. That is transferred from person to person, airborne. Very rare, but still there, especially in developing countries. Basically causes you to choke, and it can be very deadly. Tetanus, everybody's heard about tetanus. It's if you step on a rusty nail, you can get that. That is not transferred person to person. That's just if you're out in the woods, you're running around, you get a cut, that you could possibly get tetanus, which leads to lockjaw. Lockjaw is an illness where all your muscles contract at the same time. Your biceps and your triceps contract at the same time. You can't control it. It's horrifically painful. Your jaw gets tightened. This can be fatal as well. So that's why you get your tetanus boosters. And then there's also pertussis in that vaccination, which is whooping cough. Older people can handle it fairly well. Babies cannot, and that's the main reason why moms, when they're pregnant, get the vaccine, and it's recommended that everybody who's going to be in contact with a new baby get the vaccination as well. Pertussis, whooping cough, is where you keep coughing and coughing until you get to you cough out all the air in your lungs. Babies often end up in the intensive care unit if they catch this, and requires quite a bit of intervention. Again, can be fatal. We hope it's never fatal, but it can, and it's preventable. So that's the diphtheria, tetanus, pertussis vaccination. There's also a vaccination at the 2-month visit called the Haemophilus influenza B. That, I've seen it once when I was in medical school, way back when, and it can cause meningitis and something called epiglottitis, which is an infection of the membrane that separates the trachea and the esophagus. We don't see it in our country that often anymore because of the vaccine. It is in developing countries, and people are still getting meningitis and epiglottitis from it. Very safe vaccine. We give it to prevent these illnesses. We also give the streptococcal pneumonia vaccine, which is another cause of meningitis, pneumonia, and bacteremia. It can be fatal as well. So we also give the polio vaccine at 2 months of age. Polio, we haven't seen that in a while, and we're hoping not to see it for a long while, but it is present in developing countries. And we do have people coming over here, so people who have traveled to developing countries and catch it, or people coming in from developing countries to our country can bring polio, and children can catch it, adults can catch it. Polio, you might remember paralytic poliomyelitis, where people become paralyzed, where they lose strength in their limbs. They end up in the iron lung because of course we have intubation now, but people were in iron lungs way back when because they couldn't breathe, their lung muscles weren't working. So we can vaccinate against polio and prevent that. So at 2, 4, and 6 months, that's when you get all those vaccines. And it's a series of usually 3 injections, 1 oral. It's not too many. The immune system can handle it. We're being exposed all the time to things that are bad, to antigens. When you're breathing, there's germs in the air. You're breathing those. When you're eating, you're bringing in germs. If somebody's sneezing on you, you're bringing in germs, respiratory-wise. These are just antibody. These are things that your body's exposed to just rather through a shot, not through respiratory or eating or breathing. It's an injection, and your body can handle it. And again, the reason to give it to babies when they're young is so that they do start to mount the responses that you want in case they are exposed to any of these illnesses, to prevent them. Okay, now at 1 year of age, so we give those vaccines over and over again to get boosters. At 1 year of age, we give children the measles, mumps, rubella vaccine. These, again, are all preventable vaccines, all preventable illnesses, and nothing to be afraid of. The vaccines are very safe. They have been studied extensively. There is not a causation of autism with this vaccine. That was a popular theory for a while. It has been disproven by the Centers for Disease Control. The measles, mumps, rubella vaccine prevents against those three illnesses. Measles is an illness where you have a super high fever, develop a rash from the head down to the feet, get pneumonia, horrible cough, pink eye, and runny nose. Again, it can pass and the child can be well, or it can be deadly, rarely, but it can, and it also can leave children with brain damage if gotten. Rubella is another viral illness where you run fevers and break out in a rash. And very important, a mother who is pregnant, if she gets rubella, the baby develops quite a bit of birth defects. So it's very important for a mother when she gets pregnant to make sure that she is immune to rubella, and if she's not, to speak to her obstetrician and try to avoid being in exposure with anybody who might carry this childhood illness, anybody who's unvaccinated. And then also in that vaccine is preventing against the mumps. Mumps is a viral infection that affects the parotid gland. You swell up. very uncomfortable. But unfortunately, the long-lasting effects of having the mumps are infertility. In boys, it can cause a problem with the testicles, and in girls, it can cause a future problem with ovaries. So, as a parent, if you want grandchildren, prevent your child from getting the mumps. Then we also vaccinate against the chickenpox if at a year of age. Chickenpox is we all probably remember it. It's an illness where you get blisters all over your body, very itchy, fevers. In general, you're pretty miserable for about a week. It causes the child to stay home from school for about a week, be miserable, and it causes the parents to take off from work for about a week. Again, preventable disease with the vaccine. Vaccine's very safe. Also, at a year of age, we give the hepatitis A vaccination. Hepatitis A is passed, usually foodborne. Somebody who didn't wash their hands who has hepatitis A touches food, the food isn't washed properly, and people eat it. Hepatitis A causes bad infections of the liver, makes you jaundice, makes you feel pretty lousy. Most children under 6 years old don't have many symptoms of it, but older people do get it. So the children who aren't great at washing their hands could, even though they're asymptomatic, pass it on to their parents. And we have a question.
Yes. The question is, at what age will they get a flu shot?
Okay, flu shots, we would love to start them at 6 months of age. That's the youngest that we can give it. And at 6 months of age, we give, again, one vaccine now and one a month later to get them going. And then after that, it's just once a year after that. So the first time you get your vaccine, your flu vaccine, under 8 years old, you get 2. And then after that, it's just once a year. Okay, so let's continue. So again, we get vaccinations at 2 months, 4 months, 6 months, sometimes 9 months, a year, 15 months, and at 18 months again. All these are all the vaccines I discussed, and we just keep giving them again and again to get boosters, to booster up your immunity, so that whenever your body is exposed to any of this, you can fight it off. Oh, and there are more studies going on to see if there's a correlation between the measles, mumps, rubella vaccine and less effects from COVID. There's a thought that children react better to COVID because they have had these vaccines. The MMR is a live vaccine, a live attenuated vaccine, meaning you have just a very mild virus injected into you. And so the thought is that your body is getting revved up to fight infection whenever it's exposed to it, and that maybe with COVID, you'll do a better job not getting quite so sick if you catch it, if you are vaccinated with both the flu and the MMR. Okay, then last vaccines that we talk about are the teenage vaccines. At 11 years of age, we give a booster tetanus shot, the capital Tdap, the same amount of tetanus that you got at 2, 4, 6 and months, 15 months, and 5 years old, but a little less diphtheria, and a little less pertussis, just so that you don't need quite that much. You get that booster, and then you also get the meningitis vaccination. The meningitis vaccine prevents against Neisseria meningitidis, a type of bad infection you get in close contact with others, especially now that you're entering high school, and it can cause an infection along the brain and the spinal cord, and that can be fatal. And if it's not fatal, if you do catch it, undoubtedly you will be devastated, have some neurologic devastation from it. Future seizures, paralysis, brain damage of any type, not functioning quite as well as you did. Also, there's a meningitis B vaccine, a second one that we often give prior to going to sleepaway camps or to dorms when you're off to college. Same reason, rare, but if you are exposed to it, it's super infectious and, again, very devastating consequences. So very safe vaccine, preventable illness. And then lastly, vaccines that are offered for teenagers is the human papillomavirus vaccine, the Gardasil vaccine. Can start giving it as early as 9 years old, and I think it's approved now, maybe even older. It was 27. I think they've upped the age how late you can get it. Human papillomavirus is found usually sexually transmitted, can be aerosolized. Safe vaccine prevents certain forms of cancer that in females, the cervical cancer, and in also genital warts, and then in both males and females, prevents head and neck cancer. Under 15 years of age, you get 2 vaccines, one now, one in 6 months, and then over 15, you need 3 vaccines. And those are all the vaccinations that we give, and they're important, definitely, to give to your child and to prevent community spread illnesses as well.
Okay, we did have one question about alternative scheduling if you don't want to get all vaccines at once.
Okay, again, the American Academy of Pediatrics and the CDC do recommend giving your vaccines on schedule when they're recommended. And again, it's perfectly safe to give that many vaccines all at once. It's not overstressing your child's immune system. Again, they're breathing in antigens all over the place. But we understand if you are a little scared and you maybe want to just go a little slower than what's recommended. That being the case, you can once a month give a vaccine. I know there's Dr. Sears who recommends an alternative schedule. If you vaccinate your child and get them completely vaccinated, that's what we really want to see happen. We'd rather you go with the schedule, but if as long as you vaccinate your child, we're good with that.
We do have another question about SIDS within 24 hours after a vaccine. Is there a link?
According to the CDC, there is not. There's not a link between SIDS and vaccinations.
Okay, thank you. And at this time, we don't have any more questions. So
Okay.
Would you like to wrap up?
Okay. Well, thanks for listening. And if you have any further questions, please notify us on Facebook.